Dah, semua ada dah.
Semua ada, doktor.
Cuba present.
Aisyah Humaira will present the case.
Aisyah Humaira. You group apa?
Group 1 pediatric. Group 1 pediatric.
Aisyah. Ini bulan hari ni?
12 Januari. You block apa? You block apa?
Block 1. Block 1.
Present.
Okay, sudah. My name is Aisyah Humaira and I'm a
Dengar.
student. So I have.
Kau asyik cakap.
So,
Siapa bunyi apa tu?
I'm sorry, my sister. Okay.
Ni nak join? Tak apa, boleh.
Tak.
Huh?
Okay, I will continue my presentation. Okay. I have a patient. Name is Auni Darwisha, 7 years, 10 months.
Tak tahu clear lah suara you tak ni. Dekat sikit you buat komputer dah. You komputer kan handphone?
Komputer.
Okay.
Doktor dah dengar tak? Kuat ke tak kuat lagi?
Itu kuat sikit. You kata you kena cakap kuat.
Okay. Okay, I will continue my presentation. Okay, so I have a patient named Auni Darwisha, 7 years, 10 months old, malignant, with underlying throat sensitive. 7 years old, 10 months. Okay, with underlying steroid-sensitive nephrotic syndrome since March 2020 and currently compliance to the medication to 60 milligram tablet prednisolone. So she was presented to emergency department suspect with facial swelling for 1 days duration and proteinuria 3+ for 19 days duration. So history was taken from her mother. She was apparently well until 5 months ago when she was diagnosed with the nephrotic syndrome. So she was presented with fever for 3 days duration associated with productive cough, runny nose and vomiting. She also developed facial puffiness and frothy urine on the 3rd day of the illness. However, there is no leg edema and hematuria. Then she was brought by her mother to the Klinik Kesihatan Berserah on the 3rd day of the illness and urinalysis was done. So the investigation result showed that she had microscopic hematuria and proteinuria. So after that, she was referred to the suspect for further investigation and management, and she was warded for 1 week. And several investigations were done, and she was diagnosed with idiopathic nephrotic syndrome. And she was prescribed with tablet prednisolone, 60 milligram, penicillin, and omeprazole to manage her disease. And she achieved remission after 2 weeks being compliant to the disease, being compliant to the medication. And upon discharge, her mother done daily morning urine dipstick test to detect for proteinuria. And after that, she also had appointment every 2 weeks at the pediatric clinic Susmet. And the prednisolone dosage was tapered down by the doctor, slowly by the doctor, after the remission was achieved. And her disease was well controlled until June 2020. So after that, unfortunately, she had proteinuria 3+ for 3 days duration started from the 3rd June 2020, despite being compliant to the 30 milligram tablet prednisolone. So her mother also claimed that her daughter had a frothy urine, but there are no facial swelling and leg edema. So she was brought to the pediatric clinic Susmet and then reinduced again with the tablet prednisolone 60 milligram. And once again, she achieved remission within the 2-week duration and her disease was well controlled. And then the prednisolone was tapered down. So after that, on the 29th July 2020, she was brought to the clinic by her mother because she presented with the proteinuria 3+ and frothy urine for the 3 consecutive days. And then she was reinduced with the tablet prednisolone 60 milligram. And prior to her presentation, she was on the tablet prednisolone 40 milligram on the alternate day. But despite of being compliant to the medication, her mother claimed that there was no improvement in the proteinuria. And for the current admission, she was presented with proteinuria 3+ for 90 days duration and facial swelling for 1 day duration. Her mother also noticed that she had periorbital edema and facial swelling that was most prominent in the morning and exacerbated when her daughter put her head on the couch. And the swelling was reduced in the evening. And however, there is no leg edema. And her mother also claimed that her daughter had abdominal distension and also weight gain about 5 kilograms in 5 months since March 2020. And on the further questioning, so the Auni also had history of minimal productive cough with whitish sputum and running nose 3 days prior to the facial swelling presentation. The cough was intermittent in nature and associated with shortness of breath and also hemoptysis. she had a sick contact with her father who had upper respiratory tract infection recently. So her mother claimed that after her daughter take the prednisolone, her daughter started to have to have hair on the body, face and back, and her face become full, her cheek become full, and her face has her moon-like appearance face. She also had a mood swing, but her mother denied any symptoms of the depression. Okay. So otherwise, other than that, there is no constitutional symptoms such as fever, weight loss, and also loss of appetite. There is
Dia ada
also
kata
no.
increase weight gain. Increase weight over 5 kilo.
Oh,
Huh?
yes, yes, doctor.
Tadi ada weight increase over 5 kilo.
Oh, she has weight gain for of
Kenapa
the
cakap
5 kilogram in
kata
front.
weight loss waktu lepas tu?
Oh, okay. Oh, yes.
Study the history ke before you present?
I think there is no constitutional symptom, so the patient does not have any weight loss.
Yeah, but then kenapa you mention weight loss when patient ada weight gain?
Okay.
You dah mention patient ada weight gain, kenapa nak mention weight loss? Any other question?
Belum
Ada
ada question.
any ada, have you finished your HOPI?
I'm sorry, I can hear you clearly.
Has you finished your HOPI or not?
Yes.
Habis dah HOPI?
There is some small.
Huh?
There is some small. Okay.
Some what?
There is just okay.
Have you finished your HOPI? Or you still have things to add to your HOPI?
So the other things is there is no symptoms
Or
of urinary symptoms such as diarrhea, oliguria, and increase in frequency. And there are also no symptoms of the heart failure such as orthopnea and paroxysmal nocturnal dyspnea and also chest pain. There is also no other
you worry about the heart failure?
because of the edema.
Don't think edema due to because of the ni. You think edema due to heart failure? Any other thing you want to add to HOPI?
I think that's it.
That's it. Zul, any question?
I want to ask Aisha about her past medical history.
For the past medical history, she when she was 5 to 6 years old, she admitted because of the dengue fever, and she also on the July on the 13 July 2020, she was infected with scabies from her younger brother, but the rashes were improved.
Infected
With scabies.
scabies.
But the rashes was improving without any complication. She also had chickenpox at the age of 2 years old, and otherwise there is no other medical illness such as asthma and congenital abnormalities.
Nurul?
Nurul mana doktor? Ada dua.
Ada Nur Putri, Nurul. Ain. Panggil Ain lah senang. Ha.
Um,
Suka dengan nama Nurul tu, you all ni. Mesti ada 2-3 orang satu ni, satu group. Aina.
I want to ask, is there, does she feel any cold, is there any signs of hypervolemia complication, such as the cold hand or feet, or decreased urine output?
She has no sign of hypovolemic. So there is no sign, but she also complained about generalized abdominal pain for the 3 days duration. That it was 5 to 6 episodes in a day, and it lasts less than 1 minute for each episode.
Kenapa tak ada lah HOPI that one?
Because I put it in the systemic review.
Kenapa? Is one of the symptom the child is having before admission, is it?
Yes.
Kenapa dalam system review kenapa tak dalam HOPI?
That's my fault.
Huh? So they have he had abdominal pain.
Yes.
Okay. Describe to us abdominal pain.
So the abdominal pain was intermittent. It was for 3 days duration, and it was
how many days duration?
3 days duration.
3 days duration before admission.
Yes.
Betul?
And it was 5 to 6 episodes in a day, and each episode lasts about less than 1 minute. And her mother also claimed that her doctor cannot do activity each time she had the abdominal pain.
That's all.
That's all.
That's all about abdominal pain.
Yes. Yes, that's all.
Kalau tanya macam tu saya tak kena kan. Siti Aisyah. Any question?
Other than this scabies infection, does she has any other infection, for example, streptococcal infection, skin infection?
She only had a post-scabies infection, and also she had the upper respiratory tract infection because of heat contact with her father. So she developed cough and runny nose.
Shamimi.
Does the mother notice any bruising at the patient after taking the prednisolone?
There was no. The mother doesn't notice any bruising at the patient's body.
Rahimi.
Does the mother notice that the development or growth of a child is normal compared to other children or any of her child?
So according to the mother, the child is growing well and appropriate to her age. So for the gross motor, she was able to walk, run, jump and climb normally. And for the fine motor, she was able to write the alphabet and number, and she also can go to the toilet by herself. And for the speech, she also able to understand question and also give the appropriate verbal response. And for the social, she also has a normal social and communication skill, because as claimed by her mother that she had no problem socialize with her friends. So she is a talkative and friendly child.
Sasha.
Can you tell us about the immunization history of this patient?
So according to her mother, Auni was vaccinated according to the immunization schedule of the Ministry of Health. Her mother also claimed that her daughter had additional vaccination, which is pneumococcal vaccination at the age of the 5 years old because of the recurrent history of upper respiratory tract infection. And she also had never developed any rashes or fever after the vaccination.
Nurul Putri.
Just now you mentioned about the abdominal pain, right? So can I ask if there is any nausea, vomiting, diarrhea? Even?
So other than abdominal pain, there is no nausea, vomiting, and diarrhea in this patient.
Idham.
I would like to ask about the family history of the patient. Does the parent has any kind of disease or any other relative, close relative?
So the father and also the mother has no known medical illness, has no other disease, and there we also no family history of kidney disease that run in the family.
Any other questions?
Can I ask about if she has any signs of respiratory distress?
So the patient has no sign of any respiratory distress as nasal flaring. She also doesn't have a shortness of breath.
How about this patient birth history? What the antenatal, peri, and also postnatal?
For the antenatal was uneventful, and her mother also doesn't develop any medical illness. And her mother also complete all the checkup, and there was no abnormalities. For the postnatal, she was born full term. So she was born full term at the 38 weeks period of the gestation through the cesarean section. It is because there is evidence of the fetal distress by persistently bradycardic CTG, and her birth weight is 2.2 kilogram, and the surgery is a success, but she was slightly bluish. And for the postnatal, she was admitted to the NICU because of the low birth weight, and she was incubated for the 2 days. And after the 7 days, she was discharged as she achieved a weight of 2.7 kilogram. She also had a neonatal jaundice and was admitted for the phototherapy for 5 days duration. So
Can I ask about the nutritional and also feeding history of this patient?
So for the nutritional and feeding history, she was fed with the formula milk from her mother, as her mother had insufficient breast milk, and she started weaning at the age of the 6 months old with the soft food, and also her mother started to introduce the adult diet slowly as she getting older. So currently she is eating well with adequate nutrition. Her mother also claimed that her daughter's appetite increased since she took the prednisolone.
You said earlier that this patient had gained weight for 5 kilogram. So is this patient is obese or not?
So for the yang kita tengok for the BMI is 19.53. So I think she is not obese yet.
Regarding the medication that she took, besides the prescribed medication, does she take any medication, other medication like traditional medication? Also, does the child have any known food or drug allergy?
So she had not take any other medication except for the medication to treat the nephrotic syndrome, such as prednisolone, and omeprazole, and also penicillin. And she also has no drug allergy.
I would like to ask if this patient has a risk for chronic liver disease such as blood transfusion, family history of hepatitis, and so on.
Okay. So the patient, according to the history, the patient doesn't have any blood transfusion. And as I said earlier, family history, both her mother doesn't have any liver disease, but she doesn't know about family history of other relatives.
So, you think how bad is it the child relapse? Mild, moderate, or severe? Apa? Tiga je. Mild, moderate, or severe?
I think is mild.
Why you say mild?
Mild because if we do the disease nephrotic syndrome is count bad, but when we giving the penicillin is become better.
My question is, you have listened to the history. The child is having relapse.
Yes.
Oh, that's why the child been admitted. So it's mild, moderate, or severe relapse.
Doctor, can we say that this patient?
So answer dulu.
Okay.
I would say is moderate because the patient have a history of upper respiratory infection, and there is a
The one is the trigger. I just want the symptom of why you say it's moderate.
moderate because the
Tak tahu. You dengar history jadi relapse dia. Tak tahu how bad the relapse is. Tak tahu. You don't know.
tak tahu.
Tak tahu lah tu. You dengar apa? Apa yang you dengar? You dengar je lah. Dengar tapi tak boleh nak analyse. Ain?
I believe the patient is in moderate relapse because she only presented with the complication of infection and abdominal distension. And
5 kilo increase, you rasa tak significant ke? You pernah angkat tak 5 kilo tu? Beras 5 kilo pernah angkat? Beras dia berapa? What is the weight? Aisyah?
Okay.
Dia weight, dia berat asal dia.
Her weight, berasal. I don't know about the previous weight, but the current weight is 28.6. So maybe berasal dia 23.
You rasa 5 dapat 23 100%. 20% tu.
So severe due to the weight gain despite
severe weight gain.
Despite not presenting with other complications.
Ada? Why is it severe?
Due to the weight gain.
Because of the weight, or you decide is severe? Is it weight only can decide is severe?
No, also other complications such as the infection.
Infection apa?
The upper respiratory tract infection.
Upper respiratory infection is trigger lah. Oh, it doesn't say you severe or not severe.
The abdominal pain.
Even upper respiratory infection lah COVID. Tak severe ke? Tapi itu upper respiratory infection just triggered. Can trigger tell you is severity?
We need further investigation.
Oh, investigation pula. History is there already. Yeah, asthma. You think asthma people decide in term mild, moderate, or severe in term of investigation? Syamimi?
I would say it is moderate because the treatment the patient complies to the treatment
We
given.
don't ask about nephrotic syndrome. We ask about relapsed nephrotic syndrome. You listen the history, you think mild, moderate, or severe. Is severe what you expect the patient going to be like?
The patient, if severe, hypovolemic. Okay.
What do you mean?
She might present with emergency need emergency treatment.
Like?
Maybe patient appear hypovolemic.
Lagi?
Severe edema such as generous edema.
So how bad edema is?
The patient doesn't have generous edema such as leg edema or any anasaka
Which edema
symptom.
the patient have?
Pardon?
Which part is edematous?
The facial, the periorbital.
Periorbital only.
And also abdominal.
Do you think it's funny or not? Patient develop abdominal edema but no ankle edema. Don't you think it's funny? Pelik tak you rasa?
A bit weird, doctor.
Though this is weird. You know the progression of edema, you put periorbital, ankle, then develop the abdominal distension after that. Tapi this weird, is it? You think something is right in the history there?
There could be something wrong. Maybe the mother didn't notice the leg edema.
But the child have another symptoms, is it? What the child's having?
Proteinuria.
What the child is having, the symptom the child is having with abdomen.
Ascites.
The symptom lah. Oi. You tahu beza ke sign dan symptom? Ascites is sign.
Abdominal pain.
You tak ada fikir, you tak perasan. Rahimi, what you think? Mild, moderate or severe?
Moderate.
Why you say moderate?
Because Hamadi state that he doesn't have a problem with his social life. It doesn't.
Apa saya stupid sangat? My question is bukan narcotic. Apa stupid sangat you ni? I tanya the relapse, mild, moderate and severe. Apa kaitan relapse dengan social life? I'm not asking about narcotic. Kan social life, kenapa dia admit to the ward? I'm asking the relapse, the current relapse, the child admitted to the ward.
I try again.
You kat mana ke fikiran you? You follow our discussion ke tak? Why you think mild, moderate and severe? Which one?
Patient is in severe because.
Why you think severe?
Because he have abdominal pain, distension. He also complained of small productive cough.
Ya, productive cough tu boleh categorize ke severe ke? Severe tu. Is that all itu you categorize as severe? Aisyah, budak tu boleh berjalan lagi tak? During admission. Can walk, cannot walk?
It wasn't stated in the case.
It's stated in the case. You rasa tak important? You didn't study the case. Is the child screaming with pain? This child went to A&E and given any fluid or not?
There was a branula that attached at her hand, but there is no active infusion.
Active infusion during admission. Sasha. What you think? How the child condition during admission?
I think it is severe.
Why you say that?
Because she has been on proteinuria for about 19 days. Proteinuria 3
Berapa? How
plus.
much? Yeah.
3 plus. 3 plus.
3 plus. Okay.
For 19 days. And also complain of facial puffiness for 1 day. And 3 days before that, she have cough. She have
Oh, you
cough.
think the cough is bad ke? Sampai dia tak boleh nafas?
No.
Then? How bad the cough is? You think very severe sampai tak boleh nafas? Menyebabkan severity. How bad the cough is?
I think the cough is just a causal. Because you are
causal apa?
Causal for the relapse because URTI also may cause.
Come on lah, which one cause relapse? URTI or cough? Cough is sign of what?
URTI.
URTI only. Pembidima tak boleh cough. Fluid infusion tak boleh cough. Pembidima tak boleh cough. Why the child develop increase 5 kilo?
Because of the
Pardon? Why the child develop increase 5 kilo?
Hyperlipidemia.
Hyper apa?
Hyperlipidemia.
Hypernutremia apa?
Hyperlipidemia.
Hyperlipidemia, the patient increase 5 kilo. 5 kilogram lipid dalam badan dia, fat dalam badan dia.
Or maybe also because of the steroid.
Steroid apa?
Because of the steroid she has been taken, the prednisolone.
5 kilo masa bila, Aisyah?
Pardon?
Budak tu naik 5 kilo masa bila?
In 5 months since March 2020.
This March 2020. Diagnosed dia nephrotic syndrome bila?
She diagnosed with at the March 2020, but she have frequent relapse. So on this current admission is on August.
Or what?
The current admission is on August.
Ya, tapi 5 kilo tu dalam tempoh apa bulan? 6 bulan?
5 months.
5 months. Bukannya waktu dalam tempoh masa just before this admission. This admission you lose weight ke increase weight?
She increased in weight, I think, because her mother said that her appetite become more increased after the prednisolone
Yeah,
was
one 5
taken.
months. My question is that the 5 kilo to increase during that 5 month tu, or masa just before this last admission. Kan dia ada apa tu, dia ada proteinuria for 19 days. Berapa hari dia ada proteinuria? 19 days before
Yes.
this admission.
Yes, 19 days. 19 days.
Proteinuria, fluid retention, weight increase for 5 kilo. Which one? Tak tahu. Putri, what do you think?
In terms of severity, Doctor.
Ah.
Doctor tanya pasal severity tu.
Ini social challenge method. Severity. Severe.
In my opinion, it could be moderate because
What?
like Shamini has mentioned earlier, there's no sign of hypovolemia, and there's also no sign of hypovolemic shock such as tachypnea, and
apa sign hypovolemic?
yeah,
Apa sign simptom hypovolemic?
cold peripheries.
Tak tahu kan, kita ada sign dia kan. We talking about history je.
Yeah. So.
Okay, for history probably there's no hypovolemic. Apa lagi you can say? Why you say it's moderate? Why can't it severe?
Because one of the complication of nephrotic syndrome is that the patient may present with SBP, which is SBP, spontaneous bacterial peritonitis.
Okay. What do you think? The child got peritonitis or not? Don't you think I'm not worried or not when I listen to the history?
Perhaps not, but patients ada vomiting, diarrhea.
Tapi dia mention tak vomiting tadi.
Tadi Aisyah dia cakap dia no vomiting and no diarrhea.
Okay, tapi dia tahu sebab kenapa dia sebut vomiting diarrhea. Sebut saja kan, dia tak tahu kenapa important vomiting tu. Relation of child got abdominal pain. Okay, anything else? If you're talking about peritonitis, what things you would what are the symptoms the child should have?
The child should also have fever.
Lagi?
Fever, abdominal pain has mentioned.
Okay.
Diarrhea dengan vomiting tadi dah mention. Perhaps masa dalam dekat PE nanti, we could see if there's any guarding or rigidity.
Okay, there was guardian. What else in history you worry? Check up peritonitis. Ismail, what do you think? Idham.
Is it chills, doctor? The patient comes with rigors and chills because of the bacteremia.
Is having relapse, mild, moderate or severe relapse?
I think this patient will is having moderate because firstly, there is no sign and symptoms of hypovolemic shock. The second one is this patient has abdominal pain, and we can suspect that this patient has spontaneous bacterial peritonitis. However, this patient did not complain of signs and symptoms
So
of
what
SBP.
okay, the child is having peritonitis or not?
Yes, the child is having, but
If
it
they're
is not
having
severe.
peritonitis, why you say it's moderate? Why?
Doctor, can we say that this patient only have ascites but not peritonitis because
How
there
you
is
know
no
a patient
sign and
got ascites?
symptoms? Huh?
How you know a patient got ascites and how bad the ascites is?
Because the ascites does not give an impact to the patient.
How you know
It
ascites
means
not impact the patient?
because
You mean that the patient got abdominal pain tu doesn't indicate its impact to the patient. Abdominal pain to mean that if that the ascites, so the abdominal pain to indicate is the ascites doesn't impact to the patient. How significant ascites is?
Doctor, I think the ascites is significant because in the GI gastrointestinal history, it stated that her
It stated what?
It stated that the daughter cannot do activity every time she had abdominal pain. So I think it is very important.
Okay, dia nak do activity because of abdominal pain. Because of abdominal pain or because of ascites?
Because of abdominal pain.
Do you think abdominal pain due to ascites? How many patients with ascites coming with abdominal pain? And how ascites cause abdominal pain? Ascites is just water inside the peritoneal cavity. Abdominal pain is, it can be many things. And how you want to know ascites is significant or not significant? How you know ascites is significant or not significant?
Doctor, does it mean that if the ascites is significant when the patient complain about it, like abdominal pain this patient had?
If ascites is significant, is it the complete abdominal pain only? What else they complain?
Difficulty in breathing.
Difficulty in breathing. Lagi? Baru dah pakai otak. Baru ni want to use the brain. Apa lagi
Difficult to move around or eat or
difficult
drink.
to move around. Mobility. Difficult breathing. All is explainable. If you pakai otak je. Tak payah baca buku. Use imagination je. Did the patient have those things?
No.
No, tak tahu.
She didn't have those difficulties besides the abdominal pain.
No, you don't, the patient, what question asked? Patient walk or not when patient come to the hospital?
According to the general examination, patient was
But
active.
they examine the patient most of the time is already few days lah. They don't examine the patient during the admission. Rarely student come examine during admission. But can you ask the patient when the mother when you clock the mother on the when they clock the mother, you cannot ask her, mak dia boleh berjalan tak masa dia datang? Nobody asks, is it? Dia susah nafas tak masa dia datang? Ada susah nafas masa dia datang? Enggak, Aisyah?
There was no history of the shortness of breath. So
No history shortness of breath. In the HOPI, systemic review.
Yes, in the systemic review, there is no history
Not
of the
relevant. You think the shortness of breath should be in the systemic review ke HOPI?
HOPI?
It should be a positive history ke negative history HOPI? Aisyah?
Positive history.
Negative history lah. Dia tak ada negative history lah. That we call significant negative history. I confused betul. You susun bulan-bulan yang balik. Nasib you all lah. Aisyah. Siti Aisyah. Siapa tanya tadi? Idham tadi ya? Siapa tak tanya lagi ni? Daripada Idham.
Yes, doctor.
So you think what? Mild, moderate or severe?
About the
relapse.
Could it be moderate because as mentioned before, she has ascites, but however, it does not she does not come with shortness of breath, but she only have the difficulty of moving due to the abdominal pain.
We don't know kan. You only have abdominal pain saja the complain, but significant abdominal pain, in which from the history we're not clear what the cause is, but quite significant. Tapi the presenter tak tahu significant of it, but he put it in the systemic review. But this is supposed to be the HOPI. Anything else? Why you say is moderate? You don't think 19 days of proteinuria are too important? 19 days of proteinuria. 19 days significant proteinuria.
But can we say it's moderate because she does not present with generalized edema?
Okay, but you think it's possible without ascites, without generalized edema? The many patients who develop ascites without generalized edema, especially portal hypertension. You think something is right ke history ni? No generalized edema, tapi patient ada ascites.
Maybe the history is not complete.
I something wrong with history. I listen this is not right.
Mm,
Anything else? You, in your opinion, why is moderate?
mm, mm, mm.
If it's severe, how you expected severe relapse going to be? How the patient going to be?
Mm, maybe during the admission, will appear lethargy, and
Lagi?
also
Lethargy
she will
lagi apa? Anything else? Lethargy only.
wait, she maybe she will have difficulty in breathing, shortness of breath. Or maybe patient will be in could be in respiratory distress,
Okay.
or appear
Syahimi ya tanya dah? Sudah? Sudah ya? Okey lah. Zul, what the essence of the case? Zul?
I said, the essence of the case is a 7-year-old nephrotic girl who is having relapse.
Bagus. The 7 years old who are having relapse. So what the next thing come to your mind? The next thing come to your mind.
The possible causes of the relapse.
Sebelum the possible causes. Sebelum the possible causes of relapse. What did next thing come to your mind? Yeah, agree with you. Possible cause of relapse. Tapi what the next thing come to your mind? This is 7 years old boy who having relapse.
Why the patient having relapse?
Why the patient having relapse? So for me, why the patient relapse? What the possible cause of relapse?
Possible causes of relapse. A trigger of due to infection.
Infection apa? Cellulitis apa? Cellulitis.
UTI, upper respiratory, urinary tract infection. UTI.
Pardon?
Urinary tract infection.
UTI lagi?
Upper respiratory.
Lagi?
Okay.
UTI, UTI. Okay. Anything else? Causes of relapse.
cellulitis,
Ha?
skin,
Apa dia? Ha?
skin infection.
Rahimi ni. Sabar, you betul nampak sendiri.
Acute acute respiratory tract infection.
Sudah.
Oh, tidak. Asma.
Asma kau relax. Dari elok jangan tembak kepala sendiri. Causes of relapse.
Skin infection. Infection of the skin. Infection of the skin. Skin infection.
Relapse. Tu tahu aku tak tahu you hentam dia.
Perhatian pada semua keterangan Sultan Ahmad Shah
Peritonitis.
para pesakit dan pelawat sekalian. Waktu salat zuhur akan masuk dalam tempoh 10 minit daripada sekarang. Marilah kita bersama-sama menunaikan solat di awal waktu kerana Nabi Muhammad SAW pernah ditanya, apakah badan yang paling terbaik? Lalu baginda menjawab, solat di awal waktunya. Untuk makluman, solat fardu boleh dilaksanakan secara berjemaah dan mengikut SOP yang telah ditetapkan. Adalah dimaklumkan bahawa tiada pelawat dibenarkan untuk merawat pesakit dalam tempoh PKPP. Hanya seorang penjaga dibenarkan untuk menjaga pesakit di ward pada satu-satu masa. Sekian, terima kasih.
Peritonitis. Hello.
Peritonitis pula kau relapse ke? You think infection saja yang kau relapse? Benda lain tak boleh?
Drugs use.
Drug use apa?
Steroid.
Mesti tak baca ni. Stroke cause relapse. Oh, stupid sangat. Oh, Raimi. 2 kali dah kena. Apa pula stroke cause relapse? Where you can get the cause of relapse? Sasha, ada lagi cause of relapse? Sasha? Tak tahu. Nurul?
Which Nurul, Doctor?
Nurul Ain, Puteri.
Is it me, Doctor? Okay. The cause of the relapse in this patient is found out.
What is possible cause of relapse?
Among the causes
kita
of
cakap lagi in this patient, kita still what is the possible cause of relapse? Rahimi nak try lagi? Rahimi?
Stress.
Stress. Bagus tu, stress. Pandai pun. Apa lagi? Oh ni.
Injured.
What is the
trauma?
What is the cause of relapse? Kalau apa lagi? Siapa tahu? Non-compliant. Apa lagi? Underdose of medication. Lagi? Inadequate medication. Lagi? Disease become more severe. Tak boleh benda tu. Susah. Common sense kan? Betul tak? Semua common sense dia. In any disease, asthma, why do you lack? Asthma become more severe. Or dia tak non-compliant to medication. Or supposed to have a prophylaxis was not started on prophylaxis. Or if you give prophylaxis, probably a dose inadequate. Itu perlu tu ke? Perlu dapat daripada buku ke dapat benda tu? You need a book to have all those things? Semua tu common sense dia. So did her history answer all those things? Siti Aisyah, did Aisyah history to answer all those things?
The patient, even though they are this patient may not have relapse due to
My
non-compliance
question is simple, yeah.
because
You see my question kan to you kan, did her history answer all the question that we asked about the relapse? Dia dua je. Yes or no. Itu je, susahnya nak jawab. You dengar history tu kan, she present history kan. So what do you think? Did her history answer all those things? Yes or no?
sorry doctor, can you repeat again because I lost my internet
My question is simple.
connection.
Did her history, as Shah present just now, answer all the questions that we asked about relapse? Or possible cause of relapse?
Had recurring infection.
You tak faham, susah sangat you nak putar belik tu. You nak jawab. My question simple je. Jawapan dia yes or no je. My question is, did her history answer all those things that we discussed about the relapse? Yes or no? Macam nak make decision ke? You dengar history dia present tu. You dengar history, you tak analyse.
Yes.
Answer all the question. Did her history answer about compliance? Did her history answer the disease become more severe? Did her disease answer about the steroid was inadequate or need other medication? Tak boleh jawab. Syamimi.
I
Ada
think for
thing. Did her history, what can you tell you mana lagi pula? Mana Syamimi ha? Tell me the complication of steroid. Complication of steroid usage. Syamimi.
fluid retention. Fluid retention that can cause edema.
My question, you dengar the question I. What is the, tell me the side effect of steroid usage. You faham tak? You tahu tak side effect of steroid? Cuba you Google sekarang, side effect of steroid.
Easy bruising.
Lagi?
Difficulties sleeping, high blood pressure, increase in appetite and weight gain, increase of growth and body hair, blurred vision, cataracts or glaucoma, and also acne.
Itu je. Fadzil lah, I can tell more daripada buku you tau. Lozi lah, you punya buku, you punya Google ada lah something. Ismail, Idham, Google side effect of steroid.
The first one is Cushing syndrome. The second one is osteoporosis, retardation of growth.
Apa tu Cushing syndrome? Tell us what is the physical finding of Cushing syndrome?
Moon face appearance.
Lagi?
Increase in weight.
Lagi?
Wait. Buffalo hump.
Lagi?
Red cheeks. Abdominal stretch marks. Easy bruises. Thin arms and also legs. Pendulous abdomen. Obesity. Osteoporosis. Muscle wasting.
Lagi?
Skin ulcers. Central nervous system irritability and emotional disturbances.
Itu je.
Muscle weakness.
Itu je. Itu you dapat Google. Website you tak bagus lah. Anything you want to add? The side effect of steroid usage?
Hypertension.
Dah mention dah. Kalau you tak boleh hafal, Google je lah.
Mood swings.
Itu je.
Weight gain.
Okay. Kamu cakap.
Acne.
Lagi?
Irregular or absent menstrual period.
Itu lagi?
Decrease libido. Untuk
penting dia, aku dah 8 years old tu.
Severe fatigue.
Lagi?
Depression, anxiety, irritability.
In children.
Headache.
You cari adult tu kenapa? You type nak steroid toxicity children. You tak boleh type tau.
Behavior changes.
Lagi?
Hyperactive.
More important than that.
Diabetes. Diabetes.
Diabetes. Satu lagi more important in children.
Weight gain.
Ada lagi dia dah baru sebut tu. Short stature.
Yeah.
So is her history mention all those things? The side effect of steroid.
She had some mood swings.
Huh?
The mother mentioned she had some mood swings.
Itu je.
Also the Cushingoid appearance, like the hair growth.
Zul, did the patient have any complication of nephrotic syndrome? What's complication of nephrotic syndrome? Do you know? Tak tahu complication of nephrotic syndrome.
Patient, the complication of the nephrotic syndrome can be because of the can be infection.
Balik infection. Apa? Cellulitis, otis media. You ni dah menjadi doktor tau. Infection tu banyak tau. Conjunctivitis. Now, Raimi, what complication of nephrotic syndrome?
Thrombosis, thromboembolism.
Thromboembolism. What the symptom they can present?
If the patient have complication or have pulmonary embolism, so the patient may come with shortness of breath, chest
Kalau
pain.
tempat lain more important, biasanya the patient thromboembolism where do usually occur?
At the brain, the leg.
You come with what? Complaint of? Okay, what is the complication of nephrotic syndrome?
Renal insufficiency, renal failure.
Renal failure, tapi probably too early. Anything else?
Anasarca.
Anasarca, lagi?
Hypovolemia.
Hypovolemia, lagi?
Growth retardation.
The one is steroid. Hello? Salam. Tak. I tengah cuci student apa? Dia positif. Your wife, you CC2. Your wife? CC1, CC2. Tunggu result Wahyu lah. Tapi you CC2, tapi masalahnya you CC2 in family, you faham tak? You CC1, you CC2. Tapi CC2 you home CC2. Tu Ustaz Wahyu. But you CC2 yang duduk satu rumah. Tapi the other way you nak confirm with cause one. Tanya dia. Sebab dia yang tahu protokol tu. Tapi biasa CC2 kalau home, tapi kalau dia advise you stay at home, you stay at home lah. You kena inform dia. Tapi sebab apa nak sign apa tu? Itulah. Sign apa tu, you apply quarantine punya letter. You apply kenapa you tu. Macam you minggu lepas. Tapi you punya ayah you negatif. Okay, you beritahu ke dia. You beritahu dia sebab you kena beritahu sebab apa you nak ambil quarantine punya ni. Jadi sekarang wife you pula tunggu result. So you tanya dengan dia. Tapi sebenarnya tak susah. Kita ambil RPK je, you habis cerita. You offer lah, kata you alang-alang you nak buat terus supaya you datang kerja. Kalau dia kata okey, buat terus lah. Senang cerita, habis cerita. Tak payah PCR terus. Besok dapat result tu. Kalau you buat gini, besok dapat result, tu boleh balik, boleh datang kerja terus. You beritahu ke dia, you kan CC2. Tapi your close contact CC2 because your wife is CC1. Your wife CC1, masalah you household, you duduk sekali dengan dia. So you tanya dia, boleh datang kerja atau tidak? Tanya dia. Lepas tu kata dia, kalau dia kata tak boleh datang kerja, dia kata dia boleh tak you nak swap tang ni ke sebab you rasa, because you rasa dia dah 2 kali dah. Satu dengan your father, satu dengan you. Jadi you kata senang nak settlekan, you nak settlekan diri you, nak settle you tak nak pening kepala, you just swap je. So besok tahu result tu, terus you boleh ni. Senang, tidak tunggu wahyu positif. Government kadang lambat 2 hari pun dapat result dia. Jadi swap, you swap nanti, lepas tu you call me. Kalau dia macam 50-50 semua, nanti saya pujuk dia. Sebab kata staff pitch tak ada ni semua, we have all these few people lah. Pujuk dia. Kalau dia kata yes, sebab dia kena sign form tu nanti. Ada form dia tulisan, dia akan inform dia punya staff kat bawah tu buat swap. Atau you datang ke A&E dan swap. Tak, you kena masuk key in dia. Dulu dia ada key in, you faham tak? Dia kena borang satu borang tu, dia kena key in. Kalau dia kata datang dan swap, you swap terus. You swap bukan A&E dan swap. Katalah you tak cukup sebarang specialist tak cukup, sini semua senang. Sekali you swap, your wife you swap. Sekali swap dengan your wife swap. Tu tanyalah dia. Tanya dia. Tanya dia sebab sebab dia tahu, dia pun tahu. Kadang-kadang you A1 hantar tu KKM hantar ke sini. Dan sini cepat result, KKM lambat. Sini kalau you swap buat sini, besok pagi dapat result. Okey. Proaktif sikit, dia kena proaktif dengan dia orang ni. Biasanya kalau you proaktif ni semua, dia orang kadang kata menyusahkan je, tak apa, lepas senang, tak kacau lagi. Okey. Apa?
Anemia.
You Asha, you study the case or not sebelum you present? Asha?
Yes, doktor.
You baca tak side effect of steroid, side effect of complication of nephrotic syndrome?
I just read a little bit.
Just little bit. You tak rasa rugi ke? You nak present this case, lepas tu you tak study the case. Setidak you dah hafal lah cause all the steroid toxicity. Kan? You dah hafal possible cause of relapse. You boleh ni, dan you boleh bila orang tanya you, how bad is it the relapse? You kata dah, the history they say this thing, but I think the history is not adequate. If you think the history should tell us, but didn't tell us. Because you present to nephrotic syndrome tu, the history told this thing, but there are few things more that about toxicity with the history didn't tell us. Is it bruising? If the patient shot or not? If the patient have polyuria or easy fracture, acne, if patient be hairy or not, become more hairy. You tahu tak? Kenapa you all semua tak pandai? You tahu the main thing of teaching ni, masa paling penting sekali ialah masa present cases. Bukan masa buat seminar. Bukan masa ni, masa present cases. Because masa present cases we discuss the sign and symptom and the knowledge. When you present sign, symptom, knowledge, you tie up between two, you akan remember forever. Tak payah nak baca 5-6 kali, you baca sekali 2 kali je. Sebab you dah tie up dengan patient. I found out almost all the Malay group ni, bila dia present ni, dia tak nak study apa dia present. Pasal ajar sedaya tu, Chinese to present, dia study tau. He going to present about anemia. Dia dah study about anemia dah. Then dia present about anemia, dan kita discuss, sedap sebab dia boleh discuss. Sebab dia dah study. Most of you boleh present ni, you tak study sebelum you present. Apa benda you nak present? You tak tahu, that's why you rugi. You rugi. Banyak benda info. Because I'm not going to teach you all knowledge. You know why? All the side effect was steroid, causes of nephrotic, side effect or complication of nephrotic, all inside the book, all inside the internet. You boleh Google je, boleh dapat semua tu. The more important is how to tie up the knowledge with the patient. My job is to teach the knowledge to the patient. Bukan to teach your knowledge. Knowledge you kena baca. Is your prescript you kena baca sendiri. Cari knowledge. My job is to teach you how to tie up. But how I'm going to teach you to tie up when your knowledge is very poor? You still have to find. You see, it's very nice if you can tell me the causes. Can you tell me toxicity, steroid toxicity? Okay, what this patient have, what patient don't have. Sedap, kita pergi go through. The patient have this one, patient vision is normal, so probably have no cataracts. Patient have no headache, no symptom headache, no symptom fitting, probably no hypertension. We can go through nice, step by step. Satu persatu, because that is the gist of clinical medicine to tie up with the knowledge and the clinical symptom daripada history tu. You don't ever hope I'm going to teach you about knowledge. You kena cari sendiri lah. Those yang cari sendiri, I teach you how to tie up. You tahu you going to present this case, but right malam tadi you dah duduk dan study the case. Study the case. Baca about nephrotic, baca about ni, everything about nephrotic, everything about ni semua. You dah baca, you learn about nephrotic, you learn about the toxicity. Banyak benda you dah baca. You dah learn about little bit about hypertension. You learn little bit about short stature. You learn little bit about cataracts. Banyak benda you dah belajar. Itu cara orang belajar sebenarnya. That's how smart people learn. Bukannya nak learn baca, next week ada exam baru baca pasal nephrotic because you want to take the exam. Lepas exam you lupa because tak excited. Tak tahu, I tak dapat pergi kelas yang I boleh enjoy teaching. Enjoy teaching, we can teach you about that ni. We go through the sign, symptom, everything. You pun listen history pun tak tahu nak analyze. Dengar je. Any question? Any questions?
So, doctor, you mean you know how you asked us about the severity, right? So we should determine the severity from the drug toxicity lah. So we should ask further more questions to determine.
I'm talking about the labs, not talking about severity of the steroid toxicity. I'm asking you, is there any evidence of the patient have steroid toxicity or not? That's my questions. But the relapse, how severe is it the child having relapse? Why the child need admission? Sometimes relapse we cannot treat at the clinic only. But there's relapse we treat in the ward. There's relapse yang tiba-tiba kena 14 tu kena beri albumin. Why is it different relapse, different management? It depends on the severity. How you know which one? If patient got anasaka, most likely we have to give the albumin. So the clinical symptom of relapse, because the severity of relapse will tell us what kind of management going to be. Any other question? Ada question? Tak ada question? Tak ada question, habislah. Because I in principle, you kalau tak ada question, dia dua benda je. Yeah. You know everything or you know? You know everything or you know?
Nothing.
Nothing. Because if you know half thing, sure something the half you want to know. And you want to know, but you ask questions. So I presume you all know everything already. Okay. Or perhaps you don't know what you don't know. You don't know what you don't know. Yeah. Okay, ada apa lagi? Finish.
So doctor, in our case, is our patient considered moderate since she doesn't really have
tak dengar apa?
So macam severity dalam patient kita, dia severe admission kepada hospital lah kan. But even though
in this case, I have to tell you. In this case, if I going to ask the question, there's a lot of things I'm going to ask the questions to know how severe is it, because I cannot determine the severity by the current history. Because the current history, many things is loose. I cannot figure out how bad edema is. I cannot figure out why the patient got ascites without ankle edema. I cannot, because how bad there, because something I'm worried about abdominal pain. It is something we miss. Why the child got abdominal pain? How bad the abdominal pain is? It seems to be quite bad. I mean the patient very when got abdominal pain very inactive. I really, if I going to ask the person who going to class, I going to ask many other things. But you see, I justify, is it? If you say you cannot, if you say to me, doktor tak dapat nak I cannot figure out mild, moderate, and severe because why you cannot figure out? No, you kena beri justification lah. If you think it's mild, why you think it's mild? You think it's moderate, why you think it's moderate? You tak boleh, doktor ni, you tak boleh agak-agak. You tahu agak-agak tak? Saya rasa mild, moderate, tak boleh. You punya thinking dia tak boleh main ni. You mesti ada reason why you think of that something. Kenapa you rasa it's mild? Kenapa you think moderate? Kenapa you think severe? You must have a reason. Kalau you cannot make conclusion, why you cannot make conclusion?
Understood, doctor. Thank you.
You tak boleh main teka-teka. Saya teka rasa saya teka dia ni mal je, saya teka moderate je. No, doctor doesn't work like that. You have to justify whatever you want to say. You tak boleh main teka. If you want to say something, you must justify it. Okay. Senang, susah make sense. Difficult. So difficult, is it? Is it difficult or you all make it difficult? You rasa-rasa lah. Is it the medicine is difficult or you all make it difficult?
Both kot. Dua kot.
How many percent are you going to pass?
50.
How many percent? More than 90%, is it? Betul tak? Kalau difficult, you will say more than 90% going to pass. Kalau difficult, how many you expect to going to pass?
10%.
10% here. How many going to pass? You all, how many of you going to pass?
InsyaAllah all.
Dan kalau 100% lagi senang lah subjek tu. If 100% going to pass, I mean it's very easy. Subject really easy because all of you pass. Then why you say difficult? So difficulty letak kat mana? Inside here ke or where you decide difficult? Inside here. You dah decide it's difficult. That's why you all suffer. You all suffer because you already decide it's difficult. Whereas in the exam, almost all of you pass. How you say this the subject is difficult when majority pass? Logic tak? Is it logical to say the subject is difficult when majority is pass? Bukan majority, 90% pass. Yet you say subject is difficult. That's why your life difficult kan? Because you already decide the subject is difficult. Okay, Rahimi, anything to ask? Tak nampak muka, gelap.
Nothing.
Memang gelap bila rumah you lah, belakang tu. You duduk kat mana?
Dekat ruang tamu.
Ha?
Tak, saya duduk membelakangkan cahaya.
Ya. Kita nak duduk depan cahaya. Tak nampak muka you, tak nampak. Lain semua nampak. Lain semua nampak jelas. Muka you nampak cuma mata je. You duduk mana? Rumah you kat mana?
Dekat Ipoh.
Macam mana Ipoh? Ipoh tak kena PKP kan?
PKP
ada kan? Perak tak kena kan?
Perak tak kena.
Tapi you nak datang macam mana kalau you tak mentas Selangor kan?
Tak boleh.
Tapi you boleh masuk kat Highland kan?
Betul.
Selangor tak boleh masuk dah kan? Tak boleh mentas Selangor. Tak tahulah berapa lama lagi. I tak tahu. You ask me how long going to be like this, I tak tahu. You ask me. Another bulan 8 mungkin. Mungkin lah bulan 8 mungkin. If dapat 30-40% vaccinate, mungkin lah. You nak ambil vaccination? Tak nak ambil? Nak ambil tak nak ambil? Tak tahu.
Ambil.
Sekadar dulu.
Kalau free.
You orang muda apa? Risau. You muda most of you. Tapi you just got 36 years old doktor Kelang who passed away because of COVID. Muda lagi. Tapi lah kan. Dalam dia bawa kereta pun kelanggar boleh mati you kan. Time you die kan. Ya, time you die kenapa nak ambil vaksin? Kenapa tak ambil vaksin takut pula ya. Okay. jumpa, hopefully boleh jumpa lagi dalam jumpa datang. I don't know when you all can come. So you all cuma belajar teori saja. Not much we can do about that. So you all boleh kelak you punya kelak you punya ni lah, relative you, sesiapa belajar clucking. Kalau mak you ada hypertension, kelak your mother, kelak your father. Tak boleh kelak your father mother, kena marah. Kena belajar clucking, you kena practice clucking. So tidak you rugi. Okay. Okay, okay.
Tak sempat cakap thank you lagi.
Thank you, doktor.
Macam tu. Macam tu je habis. Lama.
Baru nak layan ini.
Belum sampai.
Okay lah, terima kasih semua. Good job semua, good job.
Nak screenshot
Thank you juga semua.
Thank you semua.
Good job, good job.
Senyum-senyum. 1, 2, 3. Alamak, boleh sih. Sabar. Okay dah.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.